Hi, everyone. Thank you for joining us today. My name is Elisa Macris, and I'm a business psychologist at Thrive. And today, my co-host is Johanna Scheutzu, who's also a business psychologist at Thrive. Hi, Johanna. How are you?
Hi, I'm fine, thank you. Thank you all for joining us today. I'm really glad that so many showed up.
Yeah. So this webinar will be on how parents can support their children during a crisis. These are really uncertain times for everyone, so being able to talk openly about how we feel and support each other, both practically and emotionally, is really important during these times. So just so you know, this webinar will be recorded and sent to those who are not able to attend. There will be a 15-minute Q&A at the end, so please feel free to use the Q&A box or the chat box to write any questions or comments that you might have throughout, and then we'll get to them at the end. So during this webinar, we will be talking about why parental support is important and what the positive outcomes of parental support is. We will also discuss what signs to look out for when monitoring your child's mental health and when to worry or not to worry. And lastly, how to have mindful and supportive conversations with your children about their mental well-being. And then we will talk a little bit about the challenges that you might have to face when working from home and homeschooling your children, and provide you with some tips and resources and to help you cope with these challenges. So parental support can bring about a range of positive outcomes. For example, research has found that parental support is linked with improved sleep quality and sleep quantity. Sleep is such a vital part of our well-being, as it helps us to learn as well as recharge and recover from our day-to-day activities. It also boosts our immunity. It's so important to keep a good sleep hygiene, especially during stressful times, as it really allows us to face challenges with a clearer mindset and with more energy. Stress and anxiety can disrupt sleep, so try to reassure your child that they are safe.
Yeah, I guess sleep is really important, as Elisa said, and there are various techniques you can kind of like focus on to really keep a good sleep hygiene. So for example, really stick to a sleep hygiene, so a sleep schedule. So go to bed and wake up at the same time, and do it, for example, at the same time as school times. So maybe this is at 7 a.m. and all together get up and really stick to the schedule. And maybe you also want to introduce like a pre-sleep routine. So for example, you could have together before going to sleep a cup of tea together and have a chat. Just having this like pre-sleep routine gives your body or your children's body the association to kind of fall asleep, and this is really helpful if you especially struggle with falling asleep, or your child struggles with falling asleep. And really encourage your children to use the bed only for sleeping. So if they want to do their homework, maybe encourage them to do them on their desk and not in bed, or do anything else in bed, because again, this is about the really clear association for your body to know, okay, the bed is associated with sleep and nothing else. So this really helps to develop a really healthy sleep hygiene.
Yeah, like Joanna said, if you have a schedule and you keep to a routine, this can really help you to keep to that specific timings that you want to keep asleep. And of course, like a minimum of around 7 to 8 hours of sleep is really good for you. So having a sleep schedule can really help with that, and having that routine before going to sleep to be able to calm down and let your body know that it's time for relaxation. And doing that together with your children can be quite a nice routine to have in the evenings, as well as to have these conversations in the evenings about their well-being. So warm and supportive relationships are also the best way to facilitate parent-child communication, which in turn enables parental knowledge. So being able to talk openly about your child's mental health and their worries might be helpful for both you and your child. So having these conversations can aid them to deal with challenges, and can also help you to understand what they might be feeling and what you can do to support them. Lastly, parental support has also shown to positively affect perceived self-efficacy as well as adaptability. This is especially important during times of change and uncertainty. If you have helped your child to understand that change is sometimes inevitable, but that they do have the ability to adapt and overcome these challenges, and that they can learn really valuable life lessons from them, they will most likely be able to cope with them better and be more resilient towards future challenges.
Yeah,
Being,
sorry.
no, no, go ahead.
Okay. So yeah, I guess this like being open to change and communicating with each other that change can be really great and like growing from it or like learning something from it is really important here. And we really should emphasize or focus on reflecting with our children on what we can learn from this time and what we might want to change in the future or what we could both do, for example, like trying something completely new, like doing together like an art project on a weekend or like learning a new language together on an app, or like I think there's Duolingo. So really using the time and growing from it and reflecting on it together, I think is a really key in these times.
Yeah, and being honest with your child about the situation is also key. So being honest and realistic about a situation can be really scary, but showing your child that this is something that you will deal with together and acknowledge the ups and downs of life is really important also for their own development. So this brings me on to the next point. How do I monitor my child's mental health? Here are some of the signs that you can look out for. It's important to remember that these signs display differently for every single individual. You should look out for psychological, physical, and behavioral signs or changes. Psychological signs can be anxiety, distress, tearfulness, low mood, doubt, low motivation, loss of humor, being easily upset, poor concentration, difficulty relaxing, lacking in confidence, hopelessness, pessimism, worthlessness, and thoughts of hurting oneself. Physical signs can be tiredness, headaches, appetite or weight changes, changes in sleep, shakiness, sweating, constantly feeling cold, tingling in hands and feet, heart racing, difficulty breathing, dry mouth, and dizziness. So these physical symptoms can be brought about by fight or flight or freeze responses, which are active during stressful situations. I will later talk a bit more about some relaxation exercises which can be used to help you manage these physical reactions better, which also your child can use. Then there are also behavioral signs such as irritability, anger or aggression, restlessness, repetitive speech or activity, and overreaction to problems. So there can be a combination of psychological, physical, and behavioral signs which you might spot. However, just be mindful that just because you might see some changes, this does not necessarily mean you should immediately start to worry, as mental health is similar to physical health. We can go through ups and downs and do not necessarily always require an intervention. For example, if we catch a cold, our physical health is not so good. However, our body can recover from this without needing too much medical intervention. This is the same for mental health. When we experience something stressful or sad, we might be in a low mood for some time, but many times we can recover from this low mood without needing professional psychotherapy.
Yeah, and I guess here again, it's really important to remember that we all respond differently to life changes and stress. So it might be completely like not how you would act or like how you would respond to stress as your child does. So we all have our individual way to act or like respond to the stress, and the key again here is really to communicate about it and use, for example, psychological techniques, which Elissa will elaborate on later, I guess, to calibrate your threshold to stress as well. And really staying calm. You as a parent are a role model for your children, and you model the behavior, how you respond to these uncertain times and anxiety. So it's really about like being aware how you model your behavior and trying to maybe stay calm and just be a role model for your children.
Yeah. That's true. So being able to show the appropriate behaviors and appropriate reactions can really show your child that they are safe as well and that they're in a situation which you can handle yourself.
Yeah, and that you're there for them. So really that they know that they can come to you and maybe, yeah, just talk to you about their anxiety as well.
Yeah. So my next point is, when should I start to worry? Mental health is perceived to be on a spectrum. Throughout time, we can go through ups and downs, moving from one side of the spectrum to the other. But as said before, an intervention is not always required. It is normal to feel sad, stressed, and anxious, especially during times of change and uncertainty. Suddenly, not being able to see friends or go to school is really upsetting to your child, and so they might be more irritable at times. This can be completely normal. They need some time to really adjust to the new way of living. However, if you see that there are significant and prolonged behavioral, psychological, and or physical changes, then some more attention needs to be paid. Early detection and prevention aids with the recovery. Therefore, it would be best to discreetly observe your child and how your child is behaving or feeling on a day-to-day basis. So when should I address my child's mood or ask for extra support? Foremost, you have to think about what risk there is to the self and to others. Do you think your child might try to hurt themselves? Has there been signs of this? Or do you believe that someone else might get hurt, maybe because of increased aggression? Also, if you see that changes in mood or behavior are drastic and persistent over a long period of time, it would be best to have a conversation with your child, especially if you see that they have stopped doing everyday activities which they used to enjoy, or they are significantly distressed.
Yeah, I guess just having the conversation again and checking in with your children and asking them, I realized you changed your way how you, for example, behave. Just having an honest conversation and letting them know how you perceive how they changed, and maybe asking them what they need or if there is something you can support them with, and maybe providing them with like small tools, as for example, if they have a difficult phase, building together like a self-care box when they struggle, so that they have like a box in their room where they have their preferred movie or a book, just having like a box where they could go to when they have a really intense or struggling episode.
Yeah, that's a really good idea, as well as maybe like a box where they can write down their worries and put their worries, and maybe you can go through this together with your child and see if you can find solutions or maybe just talk about these worries. So, having a conversation about mental health with your child might seem daunting at first. So, here are just a couple of pointers which might help you to get this conversation started. It's important not to make any assumptions. Your child will really not want you to decide for like how they are feeling and why they are feeling this way. The best thing to do is to ask open-ended questions which don't make assumptions about particular situations or feelings. Try to listen to your child and don't judge. If you start including your own opinion about the situation or their response, they might start getting defensive, as you might hit a nerve or have a completely wrong interpretation. So it's best to practice active listening, where you would respond by nodding or asking your child to explain something further, to encourage them to reflect and help them to come to their own conclusions as well. Reassure your child that they are safe and that you will help them get through whatever it is that that might be worrying them. Give your child time to talk about whatever they feel comfortable with opening up about. Try not to say that you are worried about them, as this might upset them because they don't want to be the cause of more of your worries. It might be difficult, but also try not to get upset and remain calm while talking to them. This will allow your child to feel comfortable with opening up and reassure them that you are able to support them. Also, keep in mind it's not always about solving the issue. Sometimes it's just good to have a shoulder to cry on and to be able to share or validate one's own feelings. Showing them that you are there in case they really need you, and also letting them know that sometimes things can't be changed, but you can learn to accept and adapt to them. Lastly, just try to show your child that talking about mental health is not a taboo subject. Be open about your own worries or feelings as much as you feel comfortable with. This will really encourage your child to open up about their own feelings as it becomes more of a natural day-to-day conversation. As we said before, maybe you could have these conversations before your child is about to go to sleep, and just to make sure that they're feeling good, or in the morning while you're having breakfast, just make them part of your daily routine.
Yeah, I guess this is a really important point, because to building a close, warm relationship, we really need to talk about our emotions with our children, and children need to learn how to appropriately express and regulate their emotions. So they look up to you as a model, and how you act on your emotions or how you behave. And there, it's really important that you talk about, for example, your own feelings, but also about their feelings, so about their negative and positive emotions, and really help them to recognize their feelings, so that they can learn to regulate them effectively later on. And yeah, just model and discuss, I think, is a really important thing, and being open just about any feelings and letting them know, for example, how you respond. So for example, if you're angry about an accident which happens to you, let your children know about this feeling and have a discussion about it. Like, how do you feel if you make a mistake or something? Just having this conversation about various emotions is a key to building this relationship and being open to each other. And yeah, helps your child to build communication skills as well. So read together, talk to your child about your day, for example, or just do something fun like singing or dancing together is a really good key to build this open conversation and the relationship with them.
Yeah, that's really important. Don't just keep things serious all the time. Have some fun, and
Yeah.
maybe integrate it into the conversation. Just, doing fun things such as the worry box that you might have, where you can see it as a little game of, putting your worries down and putting them in the box, picking one out and talking about it. So here are also some tips which are specifically related to the COVID-19 outbreak. So as Johanna said, it's really important to model appropriate behavior and try to remain calm. Show your child that you are practicing government regulations by illustrating the importance of hygiene and social distancing. If you model this appropriate behavior on a daily basis, your child will likely mirror what you're doing, and this will help them to understand how important these regulations really are. Also, if you show them that you are calm, this will reassure your child that they are safe with you, and this is something that can be coped with. Limit news consumption and make sure that they are from reliable resources. Try not to have the news playing in the background all the time, as this could really worry your child more. But also try not to shelter your child too much, as children are really intuitive, so they will know that something is not right, as they will also have seen people wearing face masks when you go out. It might be a good idea for you to consume the news first and then explain to your child what is happening, only really giving them the facts and omitting anything that's too emotional or too dramatized. The best thing to do is to help them understand the situation as much as you think is appropriate for their age, and be realistic with the expectations of what will happen next. You should take cues from your child and answer what they are asking you. Maybe invite your child to ask you questions so that you can tell them what things they've been hearing, and you can tell them what's wrong or what's right and what's true or false. Really, the point of the conversation is to avoid encouraging frightening fantasies. Also encourage mindful and open conversations like we talked about in the previous slide. So these conversations are going to be about your psychological well-being by addressing those worries or challenges that you might have to face together. Try also to deal with your own anxiety about the situation, because this will help you to remain calm and offer more support for your child. If you notice that you're feeling more anxious than usual some days, it might be a really good idea to leave the conversation to another time. You can use also psychological strategies for yourself as well as your child to help you manage your stress and anxiety, which I'm going to go through next. So here are some examples of psychological techniques which can help build resilience and cope with stress. Depending on your child's age, they might be able to practice and learn some of them by themselves, or they could do them together with you. Cognitive behavioral therapy has not just shown to be effective for treatment, but also prevention of common mental health disorders. It really helps us to understand the link between our emotions, thoughts, and behaviors. This allows us to really understand when we might be having unhelpful thoughts and helps us to change them to more helpful ones, allowing us to make more thoughtful decisions when faced with stressful events. For example, if you've ever had a situation where you were angry and you might have said some things or done some things which you later on regretted, CBT will help you to avoid these kinds of situations by helping you understand really what anxiety triggers you might have in the environment and really feel better prepared to deal with them in the future.
Yeah, and I guess also it helps, for example, your child to really identify not like labeling thoughts. So for example, if they failed in a test, that it's not that they are a failure, but it helps them to see, okay, maybe I failed, what can I do next for next time so that I don't fail. So just seeing not the failure as their personality, but as something which they can change and they can reflect on, and also reframe it in a more positive way so that it doesn't just attacks their identity and their feeling of how they feel. So I guess this technique is really helpful in terms of really helping, as Alyssa said, to identify what is helpful, what helpful thinking, and what can you do about those thoughts and reframe them in a positive way.
Yeah, exactly. And what's also really important here is that sometimes children don't really understand what emotions they are feeling. And like Johanna said, they can't really label them. So teaching them the difference between emotions, thoughts, and behaviors, and helping them to label what they might be feeling and putting them into those categories can help them get a better understanding of themselves as well. Then there are also some relaxation exercises, which can help us reduce those fight or flight or freeze symptoms that I was talking about before, such as the shallow breath and increased heart rate. So we might be feeling stressed and anxious in certain situations, and these physical symptoms might appear. And then there's relaxation exercises such as deep muscle relaxation, which is really useful right before sleep as well, where you're encouraged to tense and relax different muscle groups within your body until your whole body feels kind of limp and your mind calms down as well. Because usually when we're stressed, we tense different muscles within our body without being consciously aware of this. So this helps us to understand what tension we are holding in our body and helps us to release it so that we feel relaxed and get a better understanding of the mind-body connection that we have. Then
Yeah,
there's,
sorry,
sorry.
I guess this technique is really great, especially if your child can learn something completely new for now, but it's like a life skill, and it can use it his whole life, for example. So this is a technique, I guess, which is easy to apply with your child together, just before going to bed, practicing maybe deep muscle relaxation and tensing all the muscles together, and just enjoying this exercise together might be already nice to do.
Yeah, it's a really good idea to do them together with your child because it can be fun to do as well. And it's something that helps you relax as well as your child.
Yeah.
Calm breathing, which is also body-based relaxation exercise where you have to breathe in and out and hold your breath for a certain count. It can really help to stop the shallow breathing and help to calm down your heart rate. You're encouraged to breathe into your belly. So this calm breathing can help you overall relax your body and therefore relax your mind as well. This has also really helped with people who have panic symptoms. Then there is more mind-based relaxation exercises, which are a bit more challenging and take some more concentration, but if you feel that your child might be interested in this or that you might be interested in this, have a go. So there's meditation, which is more of an attention training exercise. Unguided meditation is quite challenging and can take some time to get into. This is where you're encouraged to observe any thoughts that pop into your head objectively without feeling that you have to do anything about them or that you have to focus on them or fix any problems. Being able to just let go and focus on the present moment and have your attention to yourself at that time, and being able to accept how you're feeling. If unguided meditation is not something that you think might be good for you, there's also guided meditation where somebody can take you to a different landscape. They can take you on a walk. They can, there's aromatherapy as well, where they tell you different scents. So just bringing your attention away from your current state to something else. That's basically what meditation is. It can take some time, but it's easy. It's an easy skill that you can master within a couple of weeks if you do it often. Then there's self-suggestion, where you either think of an image or word that you associate with the feeling of being calm. So for myself, because I'm from Greece, I used to always go take a walk by the beach when I was stressed. So the image of the tranquil sea during sunset with the golden colors was something that I've always associated with the feeling of being calm. So just popping that image into my head really helps me to feel calm again. So this can be really unique to every individual. And as said before, it's not really something that has to be an image. It can be a word like breathe, which can make you feel calm.
Yeah, sorry, here again, maybe just speak to your child and identify together like this association which Elissa just mentioned. So maybe think about what would your child like to think about to feel more calm. So this could be their garden, or it could be like a book, or like anything. Just speak to them and have a thought together on what would they like to think about, or see as a word to feel more calm. So just having this conversation again and identifying together, oh, this might be a good way to think about if you feel really stressed, or you struggle with your emotions in the moment.
Yeah, exactly. Having the open conversation about it can really help you both to understand how to relax and what helps you and your child to relax. Lastly, there's applied relaxation. This is a mix of CBT as well as deep muscle relaxation. It's one of the most advanced types of relaxation where you can relax within 30 seconds without having to go through the whole process of tensing and relaxing different muscle groups within your body. But you would have to complete some CBT sessions as well as have done some deep muscle relaxation in order to be able to practice applied relaxation. So this brings me on to the second part of this webinar. So other than trying to cope with psychological stress, it also might be difficult to come to terms with the uncertainty of when we will be able to go back to work or when schools will reopen. This challenge of having to adapt to a whole new lifestyle can take some time and might really lead to some frustration. Children now need to learn that being at home does not just mean time for relaxation or play, but also time for work. Give them some time and space to understand this, but be persistent in your approach. So model appropriate behavior. Your child, for example, showing your child when you're sitting at your laptop at a certain place in the house, this means that it is time for work, and encourage them to find their learning space as well. Maybe not in their bedroom, as Johanna said, we will relate our bedroom to sleep and relaxation. So this might not be the appropriate room. This can help them to build those physical boundaries between time for learning and time for relaxation. So for example, they will learn in the living room or in the kitchen, and in the bedroom, they will play and sleep. So what else you can do is maybe on Sunday evenings or in the morning during breakfast, talk about what your day will look like and what your time schedules are planned. Keep a routine of lunch times, break times, and learning times. This routine can really help the child to understand that there's still structure in your daily lives, even if we spend most of our time at home.
Yeah, I guess the structure is really important and being consistent about it as well. So really getting up at the same time as, for example, in school times, dressing up together. It doesn't need to be like a work outfit for you, but just as you would go maybe to school, or just, yeah, not staying in the pajama for the whole day. And as I said before, not doing school stuff in bed, for example, and setting this physical and mental boundary and the routine and sticking to it is really a key. And yeah, you should focus on that, and set a time for you, for example, for school and work together. So speak to your child and agree to each other. So for example, a few hours in the morning from 8 to 12, you both do your work or your school stuff, and then you can have lunch together. Just being clear about those physical and boundaries as well, and sticking to them, and communicating these to each other is a key here, I guess.
Yeah. I know somebody once told me that she likes to make her schedule for the week on Sunday evenings and stick it to her door so that everyone in her family knows what she's going to be up to for the rest of the week and when she needs her quiet time or alone time. So that could be a good idea as well. It's just the fact that structure in our lives really also helps us to keep a purpose in our lives. So that's why it's so important. You might feel worried about your child's curriculum as well. So don't feel that this is all your responsibility, because your child is technically not being homeschooled as they are still enrolled in school. So just stay in contact with teachers and the school and ask them to support you remotely, maybe by sending you teaching materials or explaining anything that might not be clear to you. Then there's the challenge of not being able to see friends. Allow your child to use either Skype or FaceTime to see their friends during the day so they can have a break, play with their friends, as well as maybe learn together. Maybe you can also coordinate schedules with other parents so the children know what time they can call their friends and what time they are learning and what time they can use to relax or have a break time. And make sure that there's frequent break times that you're taking, because this will really help the child to keep a fresh mind and keep concentrated. So here's just some extra support and resources. You can find really reliable advice from official healthcare providers, such as the Center of Disease Control Prevention. They have different little tasks that children can do in order to cope with any stressful situations that they have been through. And there's little tips as well on how to talk to children about any crisis situation. At-home physical exercise for kids is also provided online by the Joe Wicks Body Coach or Cosmic Kids Yoga. There are also many community support groups such as Plan C, which is a Facebook group where parents can share advice and ideas with one another. Lastly, Phonics Play is also offering their services for free at the moment to help your child learn at home. So there's so many resources out there you might come across if you're just connected with people and check out what's really happening online. So just keep your eyes open. And it can really help you to talk with other people and understand what other parents are doing at the same time to give you more ideas. So then this brings me to my recap. We talked about the importance of parental support as it brings about a range of positive outcomes such as increased sleep quality and quantity, better communication, increased self-efficacy, as well as adaptability. We covered what physical, behavioral, and psychological signs to look out for when monitoring your child's mental health, and when to have the conversation or when you should start to worry. And then I gave some tips and guidance on having mindful conversations about mental health, as well as dealing with the COVID-19 outbreak. So lastly, we talked about challenges with working from home and homeschooling and how to cope with them, as well as some extra resources and tips that could help you. So thank you for listening. This brings me on to the questions. There's a question here from Laura. Hi, these tips are great for older children. My daughter is 2 years old and I'm struggling to entertain look after her and work. Do you have any tips for younger children? I'm a bit worried she is spending a lot of time on YouTube. So your child is 2 years old, but at the same time, like mentioned before, you can use some of those relaxation exercises or some read maybe some books with her. She's old enough to be able to you can go through these relaxation exercises together with her to help her understand how to use them, or maybe you could give her some extra resources other than books, such as Johanna had said, with the painting, arts and crafts that you can do so she doesn't spend so much time on YouTube. There's many different ways you can entertain your child other than YouTube, but hopefully if you find something online, such as Plan C Group, they have many tips and many ideas on how parents can support their children and different ways that they can keep entertained during the time when they're at home. So check them out, because that will really help you. There's another question. I've started to let my 15-year-old son go for a run on his own. He is sensible, but I'm at home worrying, is this okay for him to do this? You should trust your child is able to make conscious decisions. If you've modeled appropriate behavior and shown your child the importance of keeping a good hygiene and being able to stick by government regulations, then you shouldn't be worried too much, because I'm sure that your child is conscious and aware of the situation if you've had open conversations about it. And if you really do worry quite a lot, then maybe have a conversation with him about your worries, so that you can understand what is actually happening, and your child as well can be able to calm you down and make you feel less anxious about going out. I have a 3-year-old and a 1-year-old, and it's very hard to work on laptop and keep them busy. Any advice, please? Yeah, it's quite challenging to be working from home at the same time as having very young children. The best thing to do is to find something that can keep them busy. It's up to you really to understand what your child enjoys doing the most. As said before, Plan C Facebook group has really a lot of ideas for younger children and what they can do to keep busy, such as different ideas on arts and crafts and things that they can do just like on a day-to-day basis in order to stay busy. But your child will be able to understand if you try to talk to them calmly and openly, that maybe sometimes you need to be able to concentrate, but just have patience. Just have patience with them to be able to understand that this is a new lifestyle that you need to adapt to, because it's something new for them as well.
Hi, apologies, my Wi-Fi didn't work anymore.
Oh, I was wondering where you went, don't worry.
Sorry, I'm here again.
Yeah, now I'm just going through some of the questions now. I've answered a couple of them. There were some questions about younger children, such as children that are 2 years old and 3 years old, and how to keep them busy. Do you have any advice that you would like to give? I just, like you said before, the arts and crafts and
really trying to use all the techniques which we mentioned before and doing them together, like for example doing physical exercise, like doing a YouTube physical exercise together, or practicing a new technique might be really good for you. And I think it doesn't need to be something really advanced. It can just be like dancing around and having fun together, just having this activity together and having this time for it as well. So you could do it, for example, before lunchtime and before dinner time, and just yeah, having this specific time and the routine, which helps your child to know, okay, at this specific time we do something together, and on the weekend you can really start to do like a big art project, for example. So order yourself something on Amazon, for example. I did that and start drawing together, and yeah, just creating for example, something really great together might be really good, and helps you to like cope with being stuck at home together.
Yeah, exactly. Just doing something together can really, really
Yeah.
help.
Yeah, and reading together. So as I said before, yeah, having this conversation about emotions, and just for example, if you watch a movie together, reflect on together on, for example, the characters' emotions, and just, I think, being open about like how they feel, or how they might feel and why they react in this way, just helps your child to learn how to cope with emotions and label them, first of all, might be really a key here.
Yeah. There's another question. I'm worried my 7-year-old is going to prefer being at home and have anxiety going back to school eventually. Yeah, that is an interesting worry, but you have to ask yourself, why do you think this is going to happen with your child specifically? What makes you believe this worry could be true? Because um,
Yeah.
it's
Yes, I just think of being calm about it and modeling your child that there's no reason to be anxious about going to school or going out or to work again is really important. So that your child knows you're calm about it. Why should it be then that it starts being anxious about it? So just, I think, yeah, modeling this behavior and being calm together might be a really good approach, so that your child has no reason at all to be anxious going to school.
Yeah, and make sure that your child still does have contact with children from the school, so friends over FaceTime or over whatever you can find, that this child can feel that they haven't completely lost touch with everyone in their grade or all of their friends, because this can help them to stay integrated.
Yeah, I think yeah, we have to be really aware of that. So they're missing all the school time playing together. So really help them to stay in contact with their peers, and cope with like the conversation which is missing right now, which they would normally have, for example, with their school friends. So just, yeah, be open and have probably more conversations as you would normally have in your daily life. So yeah, just coping the missing conversations which they would have at school, and yeah, supporting, as Elisa said, your child to really keep in contact with their friends, so that it's not a big change again to going to school again.
Yeah. I got up early today, 6 a.m., to do some admin work so I can finish early and give the children some time. Not sure if it can work for everyone. Yeah, that's a really good tip for everyone, to kind of adjust your schedules to one another, to be able to spend some time together, because it's really important to spend time together in the evenings, to be able to talk about things, to be able to process what's going on, and to keep open conversations. And adjusting your schedules and your times accordingly can be really, really useful. So, as said before, keeping routines, and maybe planning the week before on Sunday evenings or in the mornings while you're having breakfast, just to plan your days ahead and plan your timings together, can be really, really useful.
Yeah, and even if you feel like, for example, today is the day where you have more work to do and you might have to stay up longer, still try to stick to the normal, for example, dinner times and lunch time, and maybe add an hour in the evening, but so that your child still has the routine and doesn't wait 2 hours longer just because you have more to do for dinner time. So it really helps your child if you stick to the structure, and have it every day the same. So helping them to go to bed every day at the same time and getting up the same time, and yeah, really try to align your workload with the structure you have. And yeah, sometimes this can be really hard, but this is really helpful for your child.
Yeah, and speaking about workload and working from home, sometimes it's good to have conversations with your managers. Maybe if you need flexible working times or longer lunch breaks because you need to cook for your children, just having open conversations with your manager about what challenges you're facing at home or what your needs are at home for the time being will help you to be able to plan your schedules accordingly around your work time as well.
Yes.
So I think that's all the questions that we got for today.
Yes.
Thank you everyone for joining us. It was good to have you here and hope these tips really helped some of you. And yeah, stay safe and stay well.
Thank you.
Thank you everyone.
Okay, bye.